In this staff meeting, I'd like to briefly discuss with you the major components of electronic health records, also known as EHR. We'll also talk about the advantages, disadvantages of going paperless, and how each component will have an impact on Maven Manor. Electronic health records, or EHR, is the latest innovation in healthcare. The primary goal of EHR is to move away from paper and to solely go into electronic charts, which can be useful in areas such as medication management, quality of care, and billing. Moving an entire facility such as Maven Manor from paper documentation to electronic can be a daunting task, but if it's done properly, it can have a positive long-term effect on the quality of care we provide our patients here at Maven Manor. In order for us to better understand both the advantages and disadvantages of going paperless, we'll need to understand some of the components of EHR. Two of the components that we'll be talking about here involve clinical and administrative aspects. Two clinical components that will greatly benefit Maven Manor employees is first, computerized provider entry and clinical decision tools. The provider entry will be useful because it will create easy follow-up for providers. Now, what I mean by easy follow-ups to order things such as tests and medications. So when a physician or a provider opens a patient's chart in the EHR, they will be able to quickly glance at the patient's record. Now, on the screen, it may be something as basic demographics. They'll have the patient's name, date of birth, may have like a medication list, problem list, and even the latest lab results this patient's had. Um, Medication can, like I said, can be ordered electronically, which ensures that the patient gets quick medical care. So having quick access to what needs to be ordered and prescribed assures that the patient is receiving quality care at a faster pace than before. So before, when we were doing papers, charts, if we want a physician to order a medication or some type of testing, it would be handwritten and then often passed on to a nurse or an aide to go and fulfill the service. So sometimes doctors' penmanship is very poor, and um, it would be difficult for the nurse or the aide to decipher the order that was written. Sometimes it could be in shorthand, which is something that providers are trying to steer away from. And if it's done in this electronic record, we'll be able to have a clear understanding of what the provider is requesting. So that eliminates that time that's needed for clarification, um, which again assures that the patient is getting this service at a much more quicker pace than before. Having this type of provider order entry can reduce medication errors up to 55%. Electronic healthcare software is often tailored to a specific practice and contains a preset list of orders that the facility deems suitable for routine. This can make ordering process quicker at times, or at other times it could make the process of order things a little bit more difficult. For example, if a provider wants to order a glucose test for a patient that has a history of diabetes, the EHR will make the ordering of that glucose test a lot more. It would be a lot more faster and efficient. For example, the provider may open this patient's chart and immediately it will be flagged that this patient has diabetes and that the provider should do a glucose check because it hasn't been done in X amount of time. If we were to do this back in paper charts, this is something that may be overlooked. Maybe the provider wouldn't notice that they have to do this. So having this electronic health record ensures that the patient, once again, is getting the right type of test at the right time. But at the same time, if the provider is trying to order something that's out of the ordinary or doesn't fit that criteria for the patient, then the electronic health record may make it a little bit more difficult for the patient to go ahead and order this type of test or medication. An example would be like the same provider is opening the chart of a patient that has diabetes, and they want to order a bone density scan. It may be a little bit more difficult for them to order this scan because the EHR software may not find that this test is necessary based on the patient's medical record. Clinical decision tools can also assist a provider in making decisions with regard to patient care by providing the latest information about the drug or cross-referencing a patient's allergy to medication. These CDS tools is a great feature for physicians to manage chronic diseases. For example, if a provider opens the electronic record of that patient with diabetes, again, like we said, it may flag them to do a glucose check, or it may also like alert them that they haven't had a flu shot, and because the patient has types of immunosuppressants they would require this type of a vaccine. This feature is something that will not they won't be found on paper charts, but deciphering when this patient's last, for this specific diabetes patient, deciding when was their last glucose check may take a longer time. You may have to go through the patient's entire record. It may be something that you miss because you're not necessarily looking for that in that visit. Without the CDS tools, providers may not realize that they're not adhering to evidence-based care. Another great example for useful CDS tools are reminders for pressure ulcers. Many of our patients at Maven Manor are bedbound and are at high risk for pressure ulcers. CDS tools have decreased the development of pressure ulcers in hospital settings by 5%. Since EHR is not a perfect system, there are issues within creating this database. In order for this tool to even be more beneficial, the database for scientifically based guidelines needs to be expanded. So this database that we're given in EHR is very limited at the moment. It's only done for management of chronic diseases. It's not going to find something that is very rare, like if there's some type of bacteria or disease that has just been discovered that may not be in this database just yet. Um, right now, the database includes, like I said, frequent diseases encountered in hospital, which is a criteria that not every patient may fit. Um, Usually, this database needs to be tailored to each practice. So, illnesses and diseases that our patients here at Maven Manor have may not be something that a hospital in an inner city may encounter. So this definitely will have to be tailored to our specific site. EHR also has components that are beneficial to the administrative aspect of Maven Manor. The first administrative component of EHR is the front desk aspect, which happens to be right when the patient walks into our facility. So when a patient arrives to Maven Manor, directly from either a hospital or home, they come into our facility, and we want to make this transition as easy and smooth as possible. So before, in times of paper charts, the patient may come in again from either an outside hospital or directly from their home. We would need to collect different data such as demographics, insurance. All of this takes time and paperwork that needs to be filled out. For example, the insurance, the front desk staff may have to call to see if the patient is eligible for the insurance that they have listed. Then they have to input the information that the patient is writing down in the paperwork. But having this EHR system, when the patient arrives to the front desk, the staff will be able to verify things as demographics, insurance eligibility, and co-payment in a matter of minutes. The process will be a lot smoother because the patient is there to tell us what information is incorrect or if things needs to be changed. The process ensures that there will be fewer errors, again, because the patient will be present at the time. We won't have to have the patient check in, fill out paperwork, sit down, come back to us while we're trying to verify other information such as insurance. So having this EHR is cutting down the time that it takes for this patient to be checked in, which is beneficial to the patient because this transition is a lot smoother and a lot quicker than before. Another administrative component that is beneficial um, in EHR is billing. Billing is done more efficiently and accurately with electronic records. When a provider renders a service, it generates billing codes depending on what the provider has documented. For example, if one of our providers goes into the room, sees the patient, and does a physical exam and gives them a flu shot, they will have to go in the patient's electronic health record and document what exam was done, and they would need to document the flu shot. All of this would have to be done even before the service can be rendered. Once these billing codes are entered into the EHR system, it can generate an encounter that will be sent out for reimbursements. So imagine if the provider is able to document all the services rendered at the moment, that means that that encounter will be generated at a much quicker pace than before. If we were going to paper charts, the front desk would have to generate the billing sheet, hand it to the provider. The providers then might already go and already had provided the service to the patient without even documenting. And most of the time, these providers wait to finish their notes or documentation at the end of the day, and they're doing this based off of their shorthand notes or off of their memory. So a lot of the times, we're missing several key components to billing. They may forget that they've provided certain services and not documented. So what happens if we're not documenting this, we are not efficiently using our billing, meaning that we're not documenting everything that we're providing and we're not getting reimbursed properly in the end. Now, the biggest problem with electronic billing is that all of this is taking time away from the patient. So, like I said before, the provider might have been writing their notes after the fact that they see the patient, but now they have to do this in the room while they are actively seeing the patient. They can't move on to the next step without having documented what they've done. Um, so again, that has its pros and its cons. Medical facilities such as nursing homes oftentimes are hesitant to make this transition to electronic records. One of the biggest reasons is lack of funding. Um, that's usually the biggest hurdles that nursing homes face in this transition because they're smaller facilities. Big hospitals have a lot more funding, either from federal or it could be like a city hospital. They're getting some type of support. Most of the time, nursing homes are privately funded and at a more smaller facility. But now with these new laws and requirements in healthcare, it's making it a little bit more easier for nursing homes to be on board with transitioning to electronic records. For example, stage two requirements um, require stage two requirement use requires that hospitals and physicians submit written care summary for the patients that are being transferred. So, meaning that um, when a patient leaves a hospital and they're being transitioned to a nursing home, it is up to the hospital or the hospital to render these consult notes to the new facility. So and vice versa. So if we're sending a one of our nursing home patients to the hospital, we need to provide the hospital with some type of written care. Now, if we go back to paper charts, this may take a long time to do because we have to wait until the provider sits down and finishes their notes. Like we mentioned before, they don't always finish their notes right after or document their notes as they're providing the service. as they would with the electronic health records. So then that delays the time that it takes for the patient to transition to the hospital. So again, so now with these electronic health records, since they're doing things at the moment, they're rendering their services and they're documenting it, it will be easier to generate this consult note and this care plan that will be required when they go off to a hospital. The integration of the administrative and clinical areas of EHR system will ensure that the patient is receiving quality care and ensuring the safety of the patient. For example, there will be no redundancies in exams or orders. So since we're using these provider order entries, we will know if the patient has already had this type of test done before. It will already be documented in their record. So before, with the paper charts, maybe somebody, again, of lack of documentation, lack of time, they didn't note that the patient received some type of test. So now maybe it's a switch of shift, and now another provider comes in and sees, based off of the patient's chart, that they would require certain tests. If we move on to electronic health records, before that service is rendered, it will have to be documented. So not only is that more cost effective, it's also ensuring the safety of our patient. Most times these patients in nursing homes, they're not able to advocate for themselves, and they don't know what procedures are deemed as unnecessary. So say we have this patient may have Alzheimer's or dementia or other form of cognitive problem that they're not able to understand what has or hasn't been done. They might not know that they're getting a redundant blood work or exam. So it's good to be able to track what results and orders have been done for each patient. If the system was in place, like I said, the mistakes would be caught more easily. Being able to avoid such mistakes will, in the end, save Maven Manor money. EHR also provides to be cost effective because it limits the amount of paper wasted in treating these patients. No longer are we trying to print papers out, fax medical records. Everything can be done electronically, which is done at a much faster pace. And having this information readily available to other providers will ensure that the patient is getting quality care. At first, adopting the system will not seem like it's beneficial because because of the cost. It's going to cost quite a bit to actually adopt this EHR, implement it, and maintain it. But in the long run, we will see that there will be an increase of revenue because there will be less billing and medical errors. So in the short term, it's going to take time away from our patients because we as a facility will need to take training. We may not be able to see as many patients because it will take longer for us to document the procedures or exams or in our consult notes. But in the end, once we have been able to actually implement it, we've done training, we'll be able to see a long-term uh, benefits from this, like as mentioned before, billing and medical errors. But this time, if you have any questions about EHR, please feel free to ask. You can also email me if you have any other questions. Thank you.